I'm definitely not psychic. But the odds are you're reading this because you're interested in discovering more about the diabetes report. Well, congratulations. This is definitely the diabetes channel you've been looking for. Why? Simple. We'll give you an ongoing supply of essential news, must-have resources, and 100% free reports about diabetes. So go ahead and join our friendly diabetes YouTube channel by clicking the subscribe button now. So now let's watch the video. Diabetic eye problems. The first thing a person with diabetes should look at is their eating habits. If a person can keep their blood glucose level well under control, then there is no need for them to pay attention to their eating habits. They can eat the same amount of food that any healthy person of their age might eat, and should not have any adverse effect on their health. However, if a diabetic person cannot keep their blood glucose level well under control, then there is a need to start looking at their eating habits. If a diabetic person eats more food than they need to keep their blood glucose level well under control, then they are likely to have poor glycemic control. Glycemic control means the amount of glucose that a diabetic person's body holds per unit of energy, and this is influenced by their eating habits. Poor glycemic control means that their body is holding too much glucose, and this can lead to a diabetes complication known as hyperglycemia. It's also important to note that there is no way to tell with 100% accuracy how well a diabetic person is keeping their blood glucose level well under control. So to get the best outcome, a person should follow a diabetes meal plan and should keep a food diary to help monitor their progress. However, there are some warning signs to look for. If you find any of the following symptoms, you should talk to your doctor immediately. 1. Vision is changing rapidly. If you are noticing rapid vision changes, this could be an indicator that your blood glucose levels are getting too high and you should probably go back to your doctor. If you keep on getting new glasses or get older glasses, then your eyes are being damaged by the glucose in your blood. 2. You are becoming confused or losing your memory. If you find yourself forgetting things, then you need to work on your blood glucose level. This is called a memory problem, and it could be an indicator that your blood glucose levels are starting to rise. 3. Your actions are becoming sloppier. If you find yourself making mistakes, then it could be an indication that your blood glucose levels are starting to fall. Your blood glucose levels are being balanced by insulin, and if you are deficient in insulin, then you need to make sure that you are getting enough in to compensate. 4. You are feeling fatigued or sleepy. If you are feeling fatigued or sleepy, then it's an indication that your blood glucose levels are starting to fall. When your muscles don't use glucose to produce energy, they are slowly working off the glucose that is in your blood. 5. You are losing weight. If you are losing weight slowly, then it could be an indicator that your blood glucose levels are starting to rise. When you are at the right level of blood glucose, then your muscles have enough glucose for energy, but if you are low in glucose, then muscles are becoming depleted slowly. There are other indicators, but these are the main ones. Always make sure that you get in to see your eye doctor. If you see any of these signs, then you need to go to your eye doctor and get a fresh set of eyes. Don't think that you are invincible. Sometimes diabetes can cause eye problems. Just take care of your eyes because they can be very resilient.